For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. It's hard to believe summer is almost over, and while we'd rather not think about going back to school and getting the kids ready to get on that bus, there are some things that need to be addressed and looked at right about now to start getting you back into the mode. Laura Weller, coordinator of the Sleep Center at St. Tammany Parish Hospital, has joined us today to help you make sure you and your little ones are getting the proper amount of rest to ensure that they're getting those good grades. Laura, thanks so much for being here.
You're welcome.
Tell me a little bit about the Sleep Center overall.
The Sleep Center, we have a 4-bed center. We treat all sleep disorders. We treat children above the age of 6. We do sleep studies at night. We have a clinic during the day with a doctor who's board certified in sleep.
Do you see a lot of children at the Sleep Center?
Not a whole lot. Not a whole lot.
But it's definitely something that needs to be addressed then.
Absolutely, and we're starting to have more children than we used to have. It's getting more well known that some of the problems that they're having during the day are associated with sleep problems.
And what are some of those issues that they have sleeping?
Issues that children have sleeping, most of the time, is just not enough sleep.
Right.
But sometimes restless sleep, trouble breathing while they sleep, all those things contribute to the daytime problems that they have.
Can you give us some recommendation of hours of what kids maybe in certain age ranges should be having?
Believe it or not, most kids do not get enough sleep these days, and really toddlers to preschoolers should get 11 to 14 hours. 1st to 8th grade, 10 hours, still needing 10 hours. 9th to 10th is 9, and 11th to 12th is 8.5 hours.
What should I be getting at 32?
8 hours is great. Most people don't get that. 6 to 7 hours is the average, but 7 to 8 hours really should be what you're looking for.
What are some signs that maybe your children aren't getting enough sleep or are not sleeping correctly?
Different than adults. They show up moody, irritable, kind of sometimes hyperactivity. They have trouble concentrating in school or in sports. Whereas the adults more sleepiness during the day, falling asleep during the day. The kid will show up a little different.
Now, sleep apnea, I know, is something that y'all focus a lot on with the Sleep Center. Sleep apnea is probably not very common among children, although I know that it does happen with kids. What are some of the signs and symptoms that come with that?
If your child is struggling to breathe at night, waking up tired, hard to wake up in the morning, even after enough what you feel is enough sleep, that snoring, that gasping at night, and then during the day, difficulty concentrating, hyperactivity, moodiness, and that, again, difficulty waking up in the morning. So all of those things can go along with trouble sleeping. And sometimes it could be lack of enough sleep, or it could just be they're getting enough but having trouble with a sleep disorder.
Right, and even, getting back to sleep apnea real quick, even though it's probably more common in adults, it does happen in children.
It does happen in
Definitely
children.
something to watch for.
And first thing you look at with children is the tonsils. And so we do a sleep study on a child, we find abnormality. First thing the doctor would do is make sure that the tonsils are not enlarged, and that might be the reason for the sleep apnea.
Right. And of course your first line of defense is to start with your primary care physician.
Sure.
And then work from there. What other sleep disorders are common among kids, and kind of what can you do to correct them?
Obstructive sleep apnea, we look at the tonsils, and obstructive sleep apnea is narrowing in the airway. Some children, it's anatomical. and so they're more likely to have sleep apnea based on the anatomy of their airway. Sometimes it's the tonsils. And then other disorders, restlessness type disorders, or narcolepsy is another disorder. It's pretty rare to have narcolepsy, but it is something that a child could have.
Right.
With narcolepsy, they're basically falling asleep during the day, have a long night of sleep, long normal night of sleep, but still falling into a REM sleep during the day.
Right.
And really hard to diagnose sometimes.
Can we talk a little bit about what you can do to maybe set up the bed so that they're getting better sleep?
Yes, rituals, setting up a room that is cool, that is comfortable, that the child is comfortable with, very important. Start turning off the electronics. The electronics are huge with kids today. The electronics at least 30 minutes before bedtime. Really and truly, TVs, electronics should be out of the bedroom.
Right.
That's real hard for parents to,
nowadays, yeah.
It really is, but it's a big deal. The TV on during the night, the flashing of the lights of the TV, even though it's on low, still can wake up a patient, a child or adult.
I remember Oprah had a big campaign once. Not that I was an avid Oprah watcher, but stuck with me. You really shouldn't have a TV in the bedroom.
Really shouldn't.
Bedroom should be just for sleeping.
Yes, and those cell phones, the older ones. Now, the young children, we're talking TVs and lights and that kind of thing. But the older ones now, it's really hard. My age group was a lot different. Everything was off after 9.
Right.
No phone after 9, none of that. Now the kids have the phones in their bedrooms, and they're texting and they're answering their phone, and it's dinging and ringing through the night. As they get older, if you can eliminate that, it's important.
And I know that it's probably more of an ergonomics issue, but looking at the actual bedding itself, is that something that y'all consider too soft, too hard?
I think they just have to be comfortable, just comfortable for the patient to sleep.
Okay.
And the ritual of turning the lights down early, doing the same thing every night, setting a schedule, same time of bed every night, same wake up time at night. Even on the weekends, if you can try to keep that same schedule, waking up at the same time every day. That's really hard, but again, that's the things, if your child's having trouble, to set that schedule, very important. And again, set that calm down time, turning off those electronic devices, calm down before going to bed to help them get a restful sleep.
And these are patterns, that are great for children, but they're great for adults too. And
Yes.
it is hard to get sleep, but it's kind of like exercise. You got to make time for it.
Yes, very important.
Well, Laura, thanks so much for being with us today.
You're welcome.
I appreciate it. When we return, we'll be talking with our outpatient rehab services about how to build backpacks so that they're safer with weight loads.
They're the movers and the shakers. They're the ones who change our world. And they deserve places designed especially for them, built with kids' specific needs in mind. The latest technology in the caring hands of our dedicated pediatric specialists and primary care physicians, helping kids feel like kids. St. Tammany Parish Hospital, world-class health care for children close to home.
Welcome back to Healthy Living. We're getting you ready to go back to school, and even though it's the middle of summer, it's time to start thinking of some of these important topics. And one of the things that has become a growing issue and concern in schools is the weight of backpacks and posture. Joining us today is Susan Giovengo, a physical therapy assistant with the St. Tammany Parish Hospital Outpatient Rehab Services. Susan, thanks for being here today.
Thanks for having me.
Tell me a little bit about what your role is with posture and some of the physical issues and concerns we see with kids.
Well, we see a lot of children with backaches, and which is very sad because we don't typically think of children as having back pain and neck pain, but we see children that come in with postural issues and back pain. And one of the first things we look at are their backpacks. And sadly, we see children with overloaded backpacks. And so a child, their backpack should not be heavier than 10 to 15% of their body weight. And we see children with backpacks way heavier than they should be, and that creates a lot of stress on their bodies. They end up with forward head, rounded shoulders, and a distortion of the natural curves of their back. And over time, this creates issues with their growing bodies, and they have back pain.
Right.
So one of the things we do is educate the parents and the children on how to pack their backpacks appropriately, and also on ways to strengthen their core and how to maintain good posture.
And it's really something people are probably laughing about. You know, I'm not going to weigh my child's backpack at home. There's no reason to do that. It's just part of the whole school process. But it is a serious issue.
Yes, it is.
And
yes,
you talk about packing it, and I know you kind of walked us through that there's actually a way to pack it so that it's safe.
There
you kind of
is.
want to talk about the order that things seem to go into the bag?
Yes, absolutely. I'd be glad to. The heaviest items should go closest to the body. So your heavy books should go closer to your back. The lighter items should go farther away from the body. And utilize those zippered compartments. That's what they're for. So put your pencils, put your hand sanitizer, put your smaller items in those zippered compartments. And if it doesn't need to be there, don't put it in the backpack. I've had parents tell me they find toys and all kind of items in the backpack that shouldn't be there. If it doesn't need to be in the backpack, then don't put it in there. And also utilize your locker as much as you can. Don't put unnecessary books in your backpack because it just creates unnecessary weight.
Is there any benefit to kids, and of course asking kids to carry stuff outside of their backpack could pose its own set of issues if things not getting home, but is there any value in not overloading the backpack and carrying books in their hand?
Yes, absolutely. If the backpack is too heavy, what they can do is carry books in their, they can load their book pack to an appropriate weight and then carry their backpack, carry books in their hands.
Right.
So they can carry some books and then have their backpack on their back.
Now, loading the backpack is just one of the ways that we can make the load easier and safer. There are some other things with the straps and whatnot that I know you also go over with parents.
Yes, absolutely. You want to choose a book sack or a backpack that has nice wide straps. So you wouldn't want to have a book sack that has narrow straps. Something that's nice and padded does help to distribute the weight evenly. And you also want to make sure that these straps are adjusted appropriately to the child. So if the child puts the book sack on and it sags down, then you need to adjust these straps and make it tighter so that it's close and fits tightly to their body and it doesn't sag down. Also, this is a book sack that is for a child, but for an older adolescent or for for a young adult, they actually have waist straps that you can get, that you can put it around your waist, and it helps to evenly distribute the weight of the book sack. So you can actually carry a heavier weight.
And of course, it doesn't need to be said, but it needs to be said because people forget about it. It's kind of cool to wear it on one shoulder, but definitely take advantage of both of those straps.
Absolutely, absolutely. Children, the last thing kids want to do is look different.
Right.
And so, so they all want to look like everybody else. So carrying a book sack on both shoulders may look like a nerd, but their future self will thank them.
Right. Kind of venturing a little bit away from backpacks, but still talking about posture. One of the things you do is work with children and their posture and making sure that they're sitting upright, because that can prevent issues down the road.
Yes, yes, yes. We see so many children with postural deviations, and they have the forward head and the rounded shoulders, and we can typically look at that child and we can tell they've been spending a lot of time on gaming devices, on cell phones and whatnot, because of just their posture. And so we know that this down the line is just going to create problems, pain, and dysfunction with that child.
Right.
So we work on strengthening the muscles of the back and stretching so that they can come to a more upright posture and pull the chin back and pull the shoulder blades down, and to create a more appropriate posture.
What are some things that parents can do at home to work with their children to do that? Maybe buy one of those big exercise balls.
Those are wonderful. I love working with stability balls. We work with those in the clinic a lot. Just the simple act of sitting on a ball works the core. If you just sit there, your body has got to work because there's nothing supporting you. So just sitting on the ball, lifting one arm at a time is an excellent way to work your core. And that's just as simple as that. Works the body, works the core. Limit the amount of time that your children spend on their devices. Go outside, throw a ball. Those type of activities just as simple as that.
And how long should somebody work with their child on one of those stability balls?
Just sit on there 5 minutes a day would even be fine.
Right. And that helps, again, kind of counteract some of that backpack weight that they're putting on.
Absolutely. The effects of gravity are working against us every day. So we have to counteract those effects. So even though their bodies are young and strong, we have to help them to counteract those effects of gravity and the effects of those backpacks, pulling their shoulders forward, pulling their head forward. So we want them to stay healthy and strong and not to have problems, have an 18-year-old coming in with neck and back pain. We don't want that to happen.
Right.
So we certainly encourage people to just take a minute and look and figure out, how I can reposition my backpack to make it more, make it healthier, make it more functional, and how maybe I can limit the amount of time I spend playing on my phone and go outside and kick a ball, and
right.
And I'll be healthier in the long run for it.
One of the things I meant to ask when we were talking about backpacks was the rising popularity of the rolling backpacks. How beneficial is that? A lot of kids might be like, "Mom, I don't want to draw. I won't be the cool kid." But what is the benefit of using those?
The rolling backpacks are great. Not all schools allow them. A lot of schools do not allow the children to have the rolling backpacks. And the rolling backpacks in and of themselves and it can be problematic in that you have to use one hand to drag them, and if you leave them out into a hallway, they're a trip and fall hazard for anyone walking behind you or beside you. And if your backpack is exceedingly heavy, you may think, oh great, I don't have to worry about weight now, I can just pack my backpack and just load it up. And you have this big heavy backpack and now I'm dragging it along. I could create some instability in my shoulder.
Right.
So it's not the solution to the problem. You do have to be careful with a rolling backpack, but they are, if your school does allow them, they are wonderful. I would ask that the child switch hands, not always pull the backpack with the right hand, switch it out and pull it with the left hand sometimes.
Right.
Because that way you'll switch the load from one side of the body to the other. And just be mindful of your surroundings and don't just leave it out to where someone could trip and fall over it.
Exactly. Well, Susan, thank you so much for being here. It's great information.
Well, thanks for having me.
Always a pleasure.
I love it.
When we return, we'll be talking all about immunizations and what you can do to get your kid ready to get back into school.
After meticulous planning and loads of preparation, the instruments are ready. The lights are focused. Introducing the Covington Surgery Center, a state-of-the-art outpatient surgical facility right in your own backyard. St. Tammany Parish Hospital, world-class healthcare close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. We're talking all about making sure your kids are ready to head back to school, and then we're now joined by Robin Birdsong, a registered nurse and clinical supervisor with the Community Wellness Center at the hospital. She has some information to share about the immunizations that are going to be necessary to get your kids back in the door come August. Robin, thanks for being here today.
Thank you, Christian.
Let's jump right into those immunizations. I know it's a lot and there's a lot of lists, but it's things that the schools require and the state requires your kids to be up to date on.
Yes, absolutely.
What can you kind of walk me through the different ages and different ranges and what they need?
Primarily, we'll focus initially on the 4 to 6 year olds who are going to be entering kindergarten. And those children need to have at least 5 doses of DTaP, which is diphtheria, tetanus, and pertussis. They also need to have 4 doses of polio by that age. They need to have 2 doses of measles, mumps, and rubella vaccine. Relatively new to the schedule are 2 doses of varicella, or which most of us know as chickenpox.
Okay.
And then 3 doses of hepatitis B. Now I want to add children who are in the age 4-year-old group, they're going to additionally have to have on their immunizations the PCV13, which is pneumococcal vaccine. They should have 4 doses of that. Unless they got it at a later age, they would have less. And then there's a HIB, Haemophilus influenza B vaccine that they should have 4 doses of at age 4. After age 4, it's not required.
And I was going to say that, of course, the requirements change for each age group, but you still need them, for high school and college.
Yes, absolutely.
And what can we kind of walk through those real quick?
Yes, by the time your child gets to be 11 years old, they're going to be required to have a Tdap, which is tetanus, diphtheria, and pertussis. It's similar to what the children got when they were younger, the DTaP. It just has different amounts of the antigen. But right now they're requiring 1 dose of this because what they're finding is that the pertussis that we were immunized against as children, that immunity is not lasting.
Okay.
What they're seeing is that adults are getting pertussis or whooping cough disease, and they're giving it to babies.
And I would say whooping cough, I've seen is actually starting to make some of a comeback.
It's making a comeback, and that's why it's a big deal, and we're trying to re-immunize these teens to see if it won't prevent them getting it when they're adults.
Okay.
We're having some states that have resurgence of the whooping cough disease, and we've had some infant deaths. So they're really trying to prevent that.
Right, and you need another round when you get to college.
Yes, and actually let me go back to age 11 because it's the Tdap, and then they need the meningococcal vaccine.
Okay.
And depending on what age you get the meningococcal vaccine, you might need 1 or 2 doses.
And that protects you against what?
The meningitis, the bacterial meningitis, which can be deadly. It can actually kill. They've had some deaths, not recently that I'm aware of, but in the last few years of college-age students and teens.
It's a rare thing, but definitely it's out there.
It's out there. It's very serious. So by the time they get to college, most colleges are looking for that tetanus, but most of these children should have, or young adults should have the Tdap, and then the 2 MMR. And most colleges, not all of them, are requiring the meningitis vaccine.
And I know when they kind of changed that, when I was in college, a lot of campuses are already offering it, for the students when they're on campus. So it makes it a little bit easier for them. It's just making sure that they go out and get it.
It does make it easy. And the other thing I want to say is a lot of those college-age students, one issue they have, their parents have not been good historians of their vaccine records, so they're coming back and they'll say, well, I know I had this, and I said, we have to have the proof. So I just want to plug in about the Louisiana Immunization Network for Kids, because it's a computerized registry for vaccine records, and it's wonderful because it's permanent.
That's good to know, because I have had a problem of keeping track of, because I have not established myself yet, so I'm always having to get re-immunized. Is that even a word?
It's a word.
But yeah, keeping track of all that, so that's a great resource.
It is great. It's great.
Kind of shifting gears, Community Wellness Center provides a lot of service and does a lot of great things for the community. One of the big things that y'all are working with right now is the 5210 program. And I know you wanted to talk a little bit about how that factors into kind of getting back into the school mode and getting kids into a healthier lifestyle.
Yes, 5210 is actually a Louisiana state program, but we've incorporated it into the programs that we offer at Community Wellness Center. And it has to do with good health and good nutrition. I love it because it's a very easy thing to remember, and we all can follow this. The 5 refers to 5 fruits and vegetables a day, which is just a healthy thing to do.
Right.
And I think it's easy to remember that number. And then the 2 has to do with 2 hours or less of recreational screen time. And that includes TV, your smartphones, your video games, the computers.
Which are hard to put down, but you have to.
They're hard to put down. The other thing is at least 1 hour of physical activity a day. And that doesn't have to be in a gym. I mean, if you're just very active, for women it could be housework, for kids it could just be playing ball in the backyard, riding their bikes. And then the 0 is 0 sugar drinks and more low-fat milk and more water.
Okay.
So if people can just remember 5210, am I getting my 5210 every day?
Write it on your refrigerator, put it with the magnets or something.
Yeah, but even little children can remember that, and that'll help them, because when you go back to school, you want to make sure your children are well nourished. They're going to think better, they're going to act better during the day, just all around a better, healthy lifestyle.
And it also kind of translates to one thing that I know you wanted to talk about, which was keeping your kids healthy so they don't get sick. Right. And if they are sick, keep them home. I hear it all the time at the office, if you're sick, please don't come in, because you're not going to get better, I need you here, and you're going to get us sick. And the same thing applies for kids in school.
It's hard because we have so many parents who are working, and the dilemma for the parent is, my child's sick, then what am I going to do about my work? But parents do send children back to school too early when they're recovering from an illness, and make sure your child is free of symptoms. Make sure if they've had fever, they're free of that fever for at least 24 hours, unless your doctor has given you other guidelines. But don't send your sick child to school. Don't let the other children be exposed. It's a hard thing, but they can end up with a setback, and then you may end up being out of work longer. So.
Well, did I miss any major services that the Community Wellness Center will offer in helping you get your kids ready for school?
I don't think so. I think the biggest thing are the immunizations.
Okay.
So I just encourage everybody. I want to throw in just a little tidbit about flu, if I could, because it's not a required vaccine. But we talked about illness in school, and flu keeps children out of school, it keeps parents away from work, and it's a very simple thing that you can do to get your child immunized, the whole family. Make it a family affair.
And I
get
know
your flu shot every year.
The big concern, of course, is I don't want to get the flu shot because I'm going to get the flu from it. You know, and that's a little bit of a misconception.
It is absolutely a misconception because the flu vaccine is not a live vaccine, so you cannot get the disease from it. You might get some side effects. You might get fever that can make you feel sick, but it's not the flu. And it might take 2 to 3 weeks for that flu vaccine to work, to give you the immunities, so you might have already been exposed to the flu, but there's absolutely no way to get flu disease from the flu shot.
And we're in July right now, but you know, flu season's not till January, February. You know, it's time to start thinking of getting that vaccine now.
In the fall, yeah. Actually, starting in August, we'll start getting our supplies in. In September, we'll start getting phone calls, people asking for that flu vaccine. October, you want to try to get it a little bit before the season starts.
Gets it in and you know, takes care of it.
So, you know, September, October, those are very good times to get it. Absolutely.
Well, Robin, thanks so much for being here.
Thank you.
And thank you for watching. We'll see you next time.